Hello, my name's Lall, and I'm talking once again with my very good friend and colleague, Mr. Jeremy Latham. Jeremy, how are you doing?
Hello, Dev. Good to see you again. Thanks for having me on the show.
Pleasure, pleasure. Now, Jeremy is a consultant orthopedic surgeon based in the South Coast, Winchester specifically. And in this series of videos, we're talking about a lot of the common patients, the patients with the common problems that he sees on a regular basis. And today, Jeremy, I've got a question for you. Is it possible to be too old to have your hip sorted out?
That's a really good question, Dev, and one I get asked a lot. In fact, I had a comment on Facebook today from somebody who's been told that at 85 she's too old for a hip replacement. It's something that really upsets me, because no one's too old for surgery. If you've got a significant problem which is causing everyday disruption of your life, making your life a misery, you're never too old to have treatment. And so my feeling is that if you've been told you're too old for a hip operation, come and see somebody who specializes in that type of surgery, who has a team of people around him, like my anesthetist with whom I've worked for over 20 years, a specialist in care of the elderly medicine that we often send patients to for an opinion on their medical problems. And between us, and with, of course, the patient's consent and agreement, we share information, we get that patient in the best possible condition for surgery and make a decision about what's best for them with that patient's full support. So we can make a plan, and sometimes the patient's medical problems might be so severe that surgery would not be indicated. But in the vast majority of cases, despite having problems like heart disease, diabetes, thyroid problems, none of these problems are insurmountable. And with the team that we're surrounded with, we can get people in the best possible condition so that they can have surgery, the best operation really in the history of surgery, which is total hip replacement. Gets rid of pain, gets you back on your feet, and gets you living your life again very quickly, within a matter of weeks.
Right. Well, that's good to know. I mean, I've seen many patients. I mean, obviously, I'm not an orthopedic surgeon, I'm a general surgeon, but I've seen many people who worry about exactly the same sort of thing. My next question, of course, has to be, what's the oldest person you've ever operated on?
The oldest person I've done in the last few years was 97, and he just got on with it like nothing had happened to him.
We're more than just one condition, and that's the point of having a multidisciplinary team involved. You know, if somebody's got heart trouble, well, I know a man who can treat that and can look after that. If somebody's got, you know, diabetes, well, I know somebody who's, you know, is a specialist in diabetes, an endocrinologist, who can make sure that that's looked after optimally, so you can do your bit to help them with their hip replacement.
Exactly. And I'm not just a surgeon, Dev, like you. We're doctors primarily. I take a full history from my patients. I go through all of their medical problems. I try and identify symptoms that might indicate they've got a medical problem, and I can then help them, point them in the right direction to get assessed by the appropriate expert so that they can be optimized, ready for surgery when it's needed.
I think on that note, if there's somebody watching this who, you know, is worried about either their own hip pain or a relative, how should they get in touch with you?
The best way of getting in touch with me, Dev, is either through the telephones, speak to my secretaries, Tracy and Anne at the Wessex Nuffield Hospital, or have a look at the website, www.lathamhipsurgery.co.uk. If you sign up to the website there, the contact form, you'll be sent lots of information. Every day you'll get an email with a video attached to it, which gives you top tips and tricks about what to expect from surgery, what arthritis is, and how you might recover from your operation quickly and safely. So get in touch either way. Always happy to see people. I'm around and always available.
Excellent, excellent. Fantastic speaking to you, Jeremy, as always, and we'll speak again soon.
Good to see you, Dev. Thanks very much indeed.